A new study has raised serious concerns about the quality of air we breathe in Delhi. Researchers say the city's air contains high levels of antibiotic-resistant superbugs, posing growing public health risks. The study has been conducted by Jawaharlal Nehru University. It examined indoor and outdoor air samples across multiple locations. It found significantly high levels of staphy-loco-cal bacteria, far exceeding the WHO's recommended limits. Researchers detected methi-cillin-resistant strains, commonly known as MRS. They found that nearly 73% of the MRS were resistant to multiple antibiotics. Some carried genes that make them resistant to drugs used to treat serious infections. The study also showed seasonal variations. Superbug level peaked in winter while monsoon brought temporary relief outdoors. Scientists warn that airborne antibiotic resistance is emerging as a major urban health challenge. They are calling for continuous environmental surveillance and stronger strategies to curb antimicrobial resistance. So my question is, how can this affect health? And how is this happening? How can we combat it? On this issue, I am joined by Dr. Sunila Garg, Professor, National Medical Science Academy, Member Lancet Commission, Dr. S.K. Singh, former Director, National Center for Disease Control. Thank you both of you for joining me. Let me straight away go to Dr. Garg. Dr. Garg, can you just break it down for us as to how can this affect our health?
See, definitely it is a very, very important question that when we are thinking of antimicrobial resistance, that means we are suffering from some infection and the body is not going to respond to that. That means there are microorganisms, and particularly we say it is bacterial organisms, we say that. Okay, because of, and this problem is not of now, this is many years old. We are flagging this issue time and again. And I think you remember some time back, we had an E. coli which was resistant to all organisms, which was known as Delhi bug also. So if our body, we are suffering from infection, bacterial infections, and the body doesn't respond, that means our situation is going to worsen and we are going to end up in multi-organ failure as well. And when we try, on our body, more and more antibiotics, like, when we talk about, Staph aureus, and when we talk other organisms, even, people have tried, high level antibiotics like vancomycin and all that. So there is a risk of antibiotics, there is a risk of infection. So overall, we say that this is not a good situation, because at times we are at loss what to give to the person. There's high grade fever, the person is not responding, ICU days are increasing, the hospital infection, the hospital stay is also increasing. So that is where it is important to take the antibiotics very, very judiciously and only with the prescription of healthcare providers or doctors, I like to.
Madam, it's like a double whammy. What to say? First, it's about microplastics in air. Then you have PM 2.5, PM 10, and now the study says that you have this superbug strain. I mean, so people, the earlier idea was that in hospitals you can get this, but if it is outside hospital, why is it outside hospital? How is that happening? That transference, if I may use the word.
See, definitely, it's very important to understand this point. And we do have, now we are talking of infections in human being, we are talking of infections in animals, and we are talking environmental part, which is also known as One Health. Now, let's say if I'm suffering from one infection, or let's say I'm a case of tuberculosis, and I go out, I don't take any precautions, I'm simply coughing and coughing. So that is where the microorganisms, they can go up till the distance of 6 meters in the form of infection granules. So that part, droplets. So that part we have to understand. So that is environmental contamination. Another part is also taken care of, compounded by our animals also. That part also we have to keep in mind. But then, once they are there, and also overcrowding plays a very, very important role. Like the study pointed out, in slums it is more, because you see, we find that floor area per person is very, very less. So that part also we have to keep in mind. So any infection, if we are not taking precautions, and like let's say cough with expectoration, we are simply coughing. We are not taking any precautions. So environment is also bound to be contaminated. And also in hospitals, you can say we do have a specific this thing bed distance between the two beds and all
Okay.
that. And within that, if there is no hospital infection control, again, it is very important. The organisms are going to spread, through the environment, how they spread from one person to another. Sometimes we may not cough directly onto another person, but the organisms are there in the environment. So hospital infection control is a key pillar also of also taking care of the person and preventing the other person within the hospital to prevent infection from that
Okay, madam,
perspective.
for the benefit of our general viewers, we are talking about superbugs in air. Can we break it down for our viewers? What are these superbugs? You know, how did these superbugs came into existence? People went to treat themselves to hospitals, and suddenly, how did hospitals become site of superbugs?
See, I'll tell you one thing that as I was telling you about example of Gangaram Hospital, the person suffered from urinary tract infection and then they found after culture that there was E. coli infection and they tried nth number of antibiotics which did not and the organism did not respond. So they gave it as superbug. That means they're not responding to the antibiotics, even to the high grade of antibiotics. So that is why we have to see that, and also particularly during surgical procedures and all that, when we say, and the wounds are bound to get contaminated, and they do not respond to any of these antibiotics. So commonly used antibiotics, that's why I said, brought the name of people even went up to the stage of vancomycin and all that. So now there are very few antibiotics left, but superbugs in simple words for a common man means that our organisms, they refuse to respond to any of the antibiotics. That is important.
So, madam, what are the precautions which people will try to play out the bite of the Prime Minister? Prime Minister spoke on this misuse of antibiotics, but you know, India has this practice. You know, it's not there in America, it's not there in other countries. Off the counter ability to purchase antibiotics, madam. You know, for some, it's a poor country. You know, everyone can't go to doctor; they can purchase. You know, it's a double-edged sword. But then you also end up misusing. It's like for everything people take Norflox TZ, which is a very powerful antibiotics. I have seen doctors would not prescribe that for a general ailment. They would prescribe an antibiotic with a lower grade, not that as if, or for example, Augmentin 625, which has become almost a norm, I have noticed in various practices, whereas it's a very powerful class of an antibiotic. So in terms of, in context of social medicine, practice of medicine, in this country. How do you see that, ma'am?
See, one of the important things which you have to remember, that even pharmacies are not supposed to give this. This is
Really?
not supposed to be available over the counter, but our pharmacies are smart. They have kept one of the doctors on their panel, so they will give that and they will get the signatures of the doctors. So that part is also, so there has got to be very strict monitoring of the drug
Okay.
inspectors on these shops also. But first of all, awareness has to come from within. When PM spoke, about this antimicrobial resistance, the fundamental thing was, in a simple word, how can the message reach to a common man? So not to become your own doctor. Number two is own doctor also means going to the pharmacy and telling, मुझे tetracycline चाहिए, मुझे augmentin चाहिए, मुझे norfloxacin चाहिए. So do not become doctors of self. And similarly, pharmacies have no right to become doctors of themselves.
Okay.
So that is where we need to have, correctly prescribed drugs, so that, which can be given in correct dose at right time and at right, if it is really required. Because we find that half of the infections are only viral infection, more than half, which will subside by themselves.
Absolutely, ma'am. I'm also joined by Dr. S.K. Singh, former director, National Center for Disease Control. Sir, this Superbug story, it's very, very worrisome. Your opening comments, sir.
No, I think you have raised a very, very pertinent question. And particularly when the superbugs, we find antibiotic resistant genes in the air, polluted air, to which we all are exposed right now in Delhi and many other cities in the country. So I think we need to have a deeper look into that. The causes lie in the humans, causes lie in the overuse, misuse, disuse, and rather than having the antibiotics prescribed by the doctors, as Madam has rightly said. But we have uh, n number of ways in which antibiotics are being used rampantly, not only in the human sector but in animal sector also. Pharmacies are discharging polluted antibiotic contamination in the environment, and if we look at the environment in which to which we are exposed, we are finding these resistant. And when we look at the air polluted, they PM 2.5, that is the one which is affecting our lungs. So when our lungs are affected, they cannot respond in a normal way. In the normal defense of the body cannot respond to the infections in the normal way. So our defense system gets weakened, and that prolongs the hospital stay. That limits the use of the antibiotics, as you might have seen in the article by itself. Many of the antibiotic trimethoprim and many antibiotics are now becoming the bacteria staphylococcus pseudomonas. They are becoming resistant to that. That resistance is being monitored by the national program, AMR program, by the National Center for Disease Control. So that resistance pattern needs to be communicated not only to the clinicians, but also to the pharmacists also.
There are superbugs in air. So imagine if you have microplastics in air, if you have superbugs in air, then we are really looking at a medical crisis. And this can only be combated at the level of the society. This comes just 6 days after Prime Minister Modi warned how the misuse of antibiotics is paving way for superbugs by creating resistance to drugs.
आज मैं एक ऐसे मुद्दे पर बात करना चाहता हूं जो हम सभी के लिए चिंता का विषय बन गया है। आईसीएमआर यानी इंडियन काउंसिल ऑफ मेडिकल रिसर्च ने हाल ही में एक रिपोर्ट जारी की है। इसमें बताया गया है कि निमोनिया और यूटीआई जैसी कई बीमारियों के खिलाफ एंटीबायोटिक दवाएं कमजोर साबित हो रही हैं। हम सभी के लिए यह बहुत ही चिंताजनक है। रिपोर्ट के मुताबिक इसका एक बड़ा कारण लोगों द्वारा बिना सोचे समझे एंटीबायोटिक दवाओं का सेवन है। एंटीबायोटिक ऐसी दवाएं नहीं हैं जिन्हें यूं ही ले लिया जाए। इनका इस्तेमाल डॉक्टर की सलाह से ही करना चाहिए। आजकल लोग यह मानने लगे हैं कि बस एक गोली ले लो, हर तकलीफ दूर हो जाएगी। यही वजह है कि बीमारियां और संक्रमण इन एंटीबायोटिक दवाओं पर भारी पड़ रहे हैं। मैं आप सभी से आग्रह करता हूं कि कृपया अपनी मनमर्जी से दवाओं का इस्तेमाल करने से बचें। एंटीबायोटिक दवाओं के मामले में तो इस बात का ध्यान रखना बहुत जरूरी है